Today we'll be discussing why knee replacements don't always work. Knee replacements are highly successful operations, producing pain relief and excellent function for the vast majority of patients. But occasionally they don't work well and pain remains. Surgeons don't always get the results that they aim for, myself included. A highly active patient who wants to return to sport is very different from a sedentary patient who simply wants pain relief and easier day-to-day activities. And age doesn't always discriminate between those two groups. The main causes of failure are infection, loosening, instability, stiffness, patella, kneecap problems, and if you're very unlucky, fracture, breaks in the leg. We'll record knee talks on each of those topics in detail, but today I'll just give you a brief introduction to each one and give you an idea of why knees are sometimes disappointing when we expect great outcomes. Infection. No surgeon and no hospital has a 0% infection rate. Most good units will have far less than 1% infection rates for standard knee replacements. But patients come in individual shapes and sizes with their own individual risk factors. And that can lead to individual patients having a higher risk factor for infection, for example, than others. If you're significantly overweight, if you smoke, if you're diabetic, if you have kidney or liver or lung disease, these can all affect your infection rates. The important thing is to recognise those risks before surgery, and where possible, optimise each patient to reduce that risk factor. There's almost no one who cannot have a knee replacement, but for everybody we need to make that operation safe and where possible reduce the risk of infection. Loosening. Knee replacements are fixed to bone, either uncemented press-fit techniques or cemented acrylic grout techniques. Both work, but both have a rate of loosening that occurs over time. The choice of which type of fixation a surgeon would use depends on the patient's age, general health and activity level. It's important to choose the right implant and the right fixation for you as an individual to reduce that rate of loosening in future. Instability. A knee replacement is held together by a patient's own ligaments, just as a normal knee is. When we replace the knee, then we want those ligaments to be under exactly the right tension where possible. But sometimes there's a little bit of laxity and you will feel a little wobble in the knee. In fact, most knees, if you examine properly, will have a little extra movement in them. This normally is pain-free and does not affect function. If, however, the laxity in the ligaments is too great, then you might feel the knee giving way, it will feel unstable. That instability might lead to swelling and discomfort. Once instability occurs in the knee, it generally can be treated with physiotherapy, but sometimes a revision is needed to introduce more constraint, more internal stability into the knee. Stiffness. Although we create knee replacements to improve movement in the knee, sometimes the knee stiffens up. Now, it always happens temporarily as the knee heals, but sometimes we get too much scarring. It's called arthrofibrosis, and then the knee stiffens up permanently. If the knee stiffens up, as a surgeon we can manipulate the knee to break down that scar tissue, but more commonly we refer to physiotherapy to look at the way you stand and the way you walk and the way you exercise to regain that movement. Rarely, if there's too much scar tissue, then we need to operate to remove that scarring to create a fresh healing knee that should then both straighten and bend properly. Patella problems. The patella is the kneecap and is the bony bit at the front of the knee. It connects your thigh muscles, the extensors, to the shin bone and controls extension, straightening of the knee. For this to happen, the kneecap has to run around the corner of the knee replacement and under a lot of tension. Sometimes the kneecap, the patella, can become painful. If that's the case, then occasionally another operation is needed to put a little button at the back of the kneecap to take the tension out of the kneecap and relieve pain. These are things you can discuss with your surgeon before you have your knee replacement. If you're unlucky and fall, you can break the bones above or below the knee replacement. Should this happen, the options are either to operate to fix the broken bone with plates and screws or nails, or sometimes we have to remove the broken bone and the implant and put a different sort of replacement in there that gets rid of the broken bone. It's a rare occurrence to break around a knee replacement, but when it happens, you should talk to your surgeon about whether fixing the break or replacing the knee replacement is the right option for you. I'd like to finish this knee talk by reminding you that knee replacements are successful operations producing great pain relief and function for patients. But sometimes there are problems, and when they occur, we can deal with them. And these are issues you need to discuss with your surgeon as and when they arise. But there are always solutions, even when you have a painful knee replacement. Things cannot always be put right.